beautiful friends. Welcome back to another episode of the Light After Trauma podcast. I am your host, Alyssa Scolari, and I am super excited about today's guest. I was on Julie's podcast, the Love Food podcast, about a month or two ago, and that was an awesome episode. It was truly one of my favorite podcasts to do. Her podcast is phenomenal, so I highly recommend it. If you want to hear the episode, head over to my website, which is lightaftertrauma.com, and you can check that out in guest appearances. That was a really fun episode, and Julie and I really connected, and she is an amazing human being. So she is on my podcast today to talk about all of the good things and really to talk about something that couldn't be more perfect timing, especially given a lot of the health issues that I am having in my life right now. So let me give a formal introduction. So after sobbing in her boss's office, Julie Duffy Dillon, registered dietitian and PCOS expert, never taught another diet. It was then that she appreciated the harm of the anti-fat bias and could not unsee it. She now helps people with PCOS burn their diet books, regain the energy to live their life, and reclaim their power. Together, we will change PCOS health and care. So, for all of these reasons, obviously, from her bio, you can already tell the reasons why I have connected so well with Julie. So, let's welcome her. Hi, Julie.
Hey, Alyssa. Thank you for inviting me on your show. I am so glad to be here. Such an honor. Excited to talk.
I am nothing short of stoked. I was just telling the listeners that, I was on your incredible podcast, the Love Food podcast, and we just connected, right? We just connected right away.
Yes, totally.
And yeah, there are certain people that you meet in the podcasting world and you just sort of hit it off right away. And we met in a rather unconventional way because I showed up to Julie's podcast completely unprepared.
You're okay. It's okay.
So not my best first impression, but Julie is just a powerhouse in this field. So I am really honored to have you here. And so we're talking about PCOS, which I would just want to make sure that stands for polycystic ovarian syndrome. Is that correct?
Yes, that is correct.
All right. So can you give a little bit of a rundown on what that entails, or actually what culture and diet culture will tell you that it is and society will tell you it is versus like what it really is, because a lot of this is tied into diet culture and fat phobia and fat bias. So yeah, would you be able to give us a rundown of that?
Yes, I'm almost picturing like an Instagram graphic that has the two sides, like what society says PCOS is with like the pie chart
versus what it actually is.
I'm like, oh, maybe I'll make that after.
Yeah, some content I can spend for you.
I spend a little too much time in Canva. It's so much fun in there.
But Canva's the best.
So yeah, what people are told when they're diagnosed with PCOS, what people assume PCOS is a diagnosis that has to do with reproduction, that it has caused by a person's behavior, that a person has gained weight or eaten the wrong things and has caused these cysts on their ovaries and going to cause fertility issues. And society believes, and people who are diagnosed with PCOS are told, like, take birth control. So then you will have a cycle. And when you want to have children, not if, when you want to have children.
Never an if, right? Women aren't allowed the choice. God forbid we have a choice.
No, because that's what you're pushed for, right?
Yeah,
the misogyny is like It's just obscene and PCOS. But
sickening.
anyway, so so like a person is given, here's birth control, come back when you are trying to get pregnant and lose weight. So it's a diagnosis that people are told either directly or indirectly that they caused and that they have control over to get rid of. And those are all totally false. Totally false. And like even the name is incorrect. There are no cysts involved in PCOS.
Oh.
I know. It's like, wait, what the hell?
What the hell?
So can we give like the actual, like what we know so far scientifically, what PCOS is? Because I can't like say all that crap and not put like what we actually know.
Yeah, absolutely. Okay. What do we know? Because I feel like I don't know anything. I'm excited to learn.
Well, good. I'm glad you're excited because this is something I love talking about.
Yeah, let me get my clear gel pen and take notes.
Oh, I'm so glad you found the pen. So the PCOS, what we know about it is it's an endocrine disorder that starts in the brain, not the ovaries. And the ovaries are basically this like an organ that gets affected by this endocrine disorder. And this endocrine disorder results in this hormonal imbalance that makes this like set of symptoms. And it's also a diagnosis of exclusion. So in order for someone to get diagnosed with it, they have to exclude all these other things. And it's a quite like ambiguous kind of like question mark because it's relying on, again, this kind of set of symptoms instead of like, at this point, a blood test to find out yes or no. Like if you go in with a sore throat, you get a strep test. Oh, yeah, you have strep throat. There's lots of conditions where we can find out for sure. And with PCOS, there is no exact test currently. There's research right now on certain labs to potentially be used to help diagnose PCOS. But what we know about PCOS is that it is not something that person causes. It is a condition that is passed down through families. So it's not something that someone causes. They didn't gain too much weight. They didn't eat the wrong thing. It's not someone's fault. And because it's something that's passed down through families and a person didn't cause it through weight gain, pushing weight loss and dieting and losing weight is not going to cure it either. And it's unfortunately a condition that, especially for like on Instagram, it has this kind of set of false truths that like, oh, I could cure it if I just eat the right thing. And unfortunately, it is a chronic condition. We don't have a cure for it. So it's a lifelong kind of experience. And so learning ways to live with it. And even if someone, quote, ate perfectly or did all the things that we know to do to kind of help manage the symptoms with PCOS, it's still going to get worse just because it is a chronic condition. That's just a part of chronic conditions and diseases. One last thing is I want to mention, because I kind of said like, hey, there's not even any cysts involved with PCOS, which I think is like a great Trivial Pursuit question. If they ever would include it, like, so, polycystic ovarian syndrome, the reason why that was picked as a name is because when it was like, I think over almost 100 years ago when on ultrasound, they were able to see these string of pearls on the ovaries and for people who had this kind of set of symptoms, and they called them cysts at the time. But now what researchers and clinicians have been able to determine is that these are actually just immature follicles and not cysts. And so, and that's a really important because people with ovaries will often get cysts and like ruptured cysts and things like that. Really painful. I've had them myself. I don't have PCOS. I should have mentioned that. But, that's not something that is with PCOS, even though it's in the name. So it's kind of confusing, right?
Yeah. Now, what are some things that show up sort of in like your everyday life that would cause someone to even be like, oh, maybe I should go get tested for this?
That's a great question. So one way to kind of capture that for you, the listener, is that currently there are 3 different criteria that can be used to help diagnose PCOS, and a person needs 2 out of the 3 criteria. So I'll share with you those things. And then there's also some kind of like hints, but they're not part of the diagnostic criteria. So,
Okay.
so the three parts of the diagnostic criteria are, either irregular or no periods. So if you have ovaries and you're supposed to be menstruating and you're not menstruating, or they're super irregular, that could be one sign of PCOS. The other is some kind of signs of high androgens. So androgens are testosterone, or another one called DHEA. Those are hormones that can end up being higher in people with PCOS. And everybody with ovaries and or a uterus is going to have testosterone and other androgens, but people with PCOS oftentimes will have more androgens. And this will cause some symptoms like excess facial hair on the, I almost said excess facial hair on the face. Yes. Excess facial hair, androgenic alopecia, which is losing hair on the head. It also can cause really painful acne. Sometimes it's called cystic acne. They can almost look like boils, and it can be on the back or the chest. And so that's another sign of higher androgens. And sometimes doctors will test someone's blood to see if they have high testosterone or DHEA. But if you have like lots of extra facial hair or hair loss on your head, or these like this really painful acne, that sometimes is all the doctor needs. Like, you don't even need to worry about like spending the extra amount of money on lab work if you don't want to.
Right.
Some doctors, that's like the clinical observation is enough. So then the last of the three is if you get an ultrasound and they see that those kind of quote cysts or the multiple immature follicles on the ovaries. And remember, you only need 2 out of the 3 of those. So someone could have PCOS and not even have those multiple follicles. And, for a lot of people, what happens is that they will have like really heavy and really irregular periods. And like, this is kind of like the hints that you may have PCOS. And also experiences with changes in mood, especially as you started menstruating or the time of when you thought you would start menstruating the first time. A mood disorder oftentimes is like the first sign and symptom of PCOS when people like look back. And again, it's because PCOS is an endocrine disorder that starts in the brain, like in the hypothalamus. And Alyssa, I know you know the hypothalamus more than me as a therapist. Like that's where all the mood juice is, right? So
yeah, I love that you called it that, the mood juice.
I don't know. I don't think I've ever called it before, and I'm like kind of frightened that I just did.
Oh my God, that was amazing. I will forever be using that. That's the mood juice.
It's all yours. But anyway, so that's one thing. And then there's also, because of the hormonal imbalance, this is not a way to be diagnosed with PCOS, but for about 75 to 95% of people with PCOS, they also have high circulating insulin. And so when someone has really high insulin levels, they will feel really tired and not sleep well, which is, like, I'm so tired, but I can't sleep, that kind of like exhaustion that comes with that. And then also, and this is where as a dietitian, I found myself a lot, these really intense carb cravings. And I was just talking to some people within my course community yesterday about these cravings. And one person was like, the word craving, that just doesn't describe it well enough, because craving just sounds too subtle. It was like every part of my body needed these carbs. Yes. Like I was going to die without them. Yes. And I've often used the word like primal, but and I'm appreciating, especially because I don't have PCOS, that like I haven't figured out a way to capture it yet. But if you have this like just total pull to eat carbohydrates, and maybe you have called yourself a food addict before, or binge eat and feel like maybe you've used the word for the phrase, like, I feel out of control with food, and you also identify with some of the things I've said, you may have PCOS. Like that's a really kind of common presentation, especially that I would see as a dietitian.
Wow. Okay. So this is a lot for my brain. This is like,
I know I gave you I dumped a lot.
Well, it's amazing because it actively is like, oh, this is what this actually is, versus like, this is what society has made me think that this is. And I just wish, it makes me sad for the folks out there who are not informed, because I'm sure this diagnosis is going underreported in so many people. One of the reasons being fat phobia and fat bias, and people just assuming that we have control over our weight in all aspects of our body. Now, I guess bringing it back a little bit, because you have mentioned that you don't have PCOS. So how did you get into this career path? Because I do not question at all your passion for this topic. And I'm wondering, like, what drives your passion for this, for all things, dietitian related, PCOS related? Where does that come from?
It's something that I didn't set out to really specialize in. I've always been a bit of an oddball, like an awkward dietitian is kind of a phrase I've used before. A lot of my colleagues who I love dearly are really like detail oriented colleagues of mine, because we're trained to be scientists. And I just never identified to be like that. And I'm probably wired more like a therapist. And I probably should have studied that to begin with, but I didn't. And so when I finished my training to be a dietitian, and then I have a master's in counseling, once I finished that, I started to work with eating disorders, and I loved food behavior and just really wanted to get into that. And any diagnosis that any kind of consult that would come my way that was had to do with any kind of like medical diagnosis, I would refer out, because I was like, no, I just want to work in food behavior. But then people with PCOS had lots of eating disorders too. And so I just kept having people with PCOS that were my clients. And I have these experiences of like trying to just search for answers. Like, how do I help people with PCOS? Like, people with PCOS deserve to feel like at home in their body too. Like, they deserve recovery. They deserve to like be free from diet culture. They deserve food peace as well. And so I had all these tools to help people, especially thin people, with eating disorder recovery, but yet with PCOS, it just kept falling short. And I kept looking outside of like my area where I lived, and there was nothing. And this was in 2004, 2005. So there was barely an internet. It was baby internet at this point. Right. So I finally found someone to kind of take me under their wing. And she was someone who wasn't, I guess what you would say, like 100% weight inclusive, but she was willing to not push dieting for PCOS. And so she helped me just to learn some different tools. And what she always said, because I was always so grateful, her name was Monica Woolsey, and she died in 2017. But before she died, I remember telling her, like, I'm just so grateful for everything you taught me. And she's like, well, yeah, but you took it and ran with it. Like, but she like helped me to like learn a different foundation. And so I'm hoping by doing that work for years and years, and honestly, like sitting across from people in that space where I was like just trying to experiment, like throwing spaghetti at the wall to see what would stick. Clients were also engaged in that process too, of like, yeah, let's figure out what works, Yep. And so I feel like a tremendous gratitude for clients who were willing to do that, who basically helped us gather this data of like, this is what helps for a lot of people. This is what helps some people. And this is what helped a few, without dieting. And so hopefully we can pass the baton. And there's so many more clinicians who are weight inclusive, helping people with PCOS. And that makes me feel, I can feel my shoulders like dropping off away from my ears, even saying that. It makes me feel like such a sigh of relief, because there was literally nothing before.
Nothing. And it is so heartwarming to see the changes, and the changes are so needed. And, in your experience, like, I guess, why is this a problem? Like, why is finding somebody who is weight inclusive so important when it comes to, honestly, food in general, but also particularly like getting this diagnosis?
So from a perspective of someone who is trying to manage long-term their PCOS, having someone on their side that is weight inclusive, it just, there's so much to that.
I know that's a loaded question.
Shavise Turner is a therapist out of Maryland who one time said, I love this quote. She said, she's like, the medical community is just so married to the weight loss paradigm, they can't see outside of it.
Oh.
And that is something that I think a lot about for people with PCOS. Like when you are told that you need to be fixed, it's not getting you the tools that you need in order to like help you to like, again, feel it and like feel at home in your body and to feel powerful enough to like then look outside of yourself. Because, you know, what I teach within my program is that like so much of PCOS management, and when I say management, I mean like it's finding tools for you to help like to like live with this chronic condition. Like this is going to be lifelong. And here are some tools that we have. Let's sift through the things that are going to be helpful for you, while also looking outside of yourself to realize that you're not the one that's broken, that this world and this diet culture world rooted in white supremacy, that's what's broken. Yeah. And so here's this armor, you know, and let's bring together an army of people so we can be stronger together to help change PCOS care. And that's the only way I can see moving forward is for us to all like rally together, whether it's people with PCOS and also people like me who don't have it, but just help people with PCOS, like coming together to hopefully make it more normal to like, so when people are diagnosed, they're not just told like that, here's birth control, lose weight, that people are told the truth of actually what this condition is. And also like told that like, especially that they didn't cause it and reminded of that
Yes.
over and over and over again. I work with some people that are aligned with fat positive body liberation. Like that's been a part of their life for decades. And they'll say, Julie, I still need to be reminded that I didn't cause my PCOS. Like that's how pervasive PCOS healthcare is with diet culture, like how intertwined it is and how traumatic it is for them to just like get their yearly appointment done with their endocrinologist. Yes. Or to seek reproductive medicine. Again, I know that word trauma is as a part of your podcast, but also like used a lot these days, but it's something that I firmly believe in. Like people with PCOS period are experiencing so much trauma just seeking care, and that needs to change. And I think the only way it's just going to change is for all this to come together to like, you know, move the paradigm, like the one that Shavise was talking about.
Yes. Absolutely. And you nailed it, right? The process itself of even getting treatment and getting help or even getting a diagnosis in the first place is in itself traumatic. And timing is such a fascinating thing to me because as we're having this conversation, I am less than 48 hours out from a doctor's appointment. And now, so I have had several doctor's appointments in the last couple of months. And I'm sure, you know, I've been keeping the listeners up to date and aware for the most part. So many of the listeners know. So I have been having severe menstrual cramping, severe. And it has gotten worse every single month. And I have seen so many doctors that have thrown a mixture of Advil and the pill at me. And I have been told, you know, even when I go for the period cramping, somehow I am always told that everything in my life would be better if I just lost weight. And right, it is the biggest crock of shit I have ever heard in my life. But right, you know, people who, myself included, right, even though I'm aware of this, it still didn't make it less traumatizing for me to go to doctor after doctor and be told. I went to an endocrinologist because I was also having issues with just rapid weight gain a while back. And I was told, oh, well, you should try walking 20 minutes a day.
Shut up.
Yep. That is what this
That's
renowned
laughable. Oh my gosh.
endocrinologist said to me. And then I had a doctor's appointment several weeks ago, and I went in and I was sort of like, look, I'm at my wit's end here. My period is coming every 3 weeks. I am having cramps so severely that I am vomiting. I'm having these like weird fluctuations in my weight. There is something going on that I believe is deeply rooted in my hormones, possible endometriosis. I need you to listen to me. And she said, well, your kidneys aren't going to like this, but you should load up on Advil the day before your period. That will probably help. And then also for everything else, have you ever considered prescription diet pills? I can refer you to our weight loss doctor.
Oh my gosh. Wow.
And I sobbed in that doctor's office because I was just written off as I hear that you're in pain, but this is probably your fault because you're fat and you won't lose weight, or are telling me you can't lose weight. So we're going to put you on a pill because I think that as long as you're not fat, it'll solve your problems.
Yeah.
Which is her projecting her own discomfort of my body onto me.
Yeah.
So this is
that's so much. I'm so sorry, Alyssa. That's
Thank you. I mean, listen, I was really looking forward to talking to you about it because I knew you would feel like it was absolute bullshit. And now I will
100% bullshit.
Absolute bullshit. Now I will say this to the listeners, okay? Because not taking anyone else's shit has really paid off because I ended up making multiple doctor's appointments. And this past week, like I said, less than 48 hours ago, I met with a doctor who was not only deeply apologetic and frustrated for everything I've been told, but finally explained to me exactly what endometriosis is and exactly what my next steps are in terms of surgery and being referred to a doctor who specializes in all of this. So there are people out there who will listen, but sometimes it takes a lot of fighting to be able to find those people.
Yeah. 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 And, your experience getting dismissed by your doctor and also the assumptions that were made on your movement, that obviously you want to be smaller. Like, let me give you this medicine to make you small. Like, those are the assumptions that people with PCOS are experiencing every time they get healthcare, unless they're lucky enough to be able to connect with a weight inclusive provider. And I mean, there's very, very few. I have one hand raised of all the MDs that I know, not just near me, but like total. And that's just not okay. And it's heartbreaking how that is just the norm. And also there's something about ovaries and periods and, I think it's more normal now, but 10 years ago and earlier, people didn't talk about their periods, And so, so much of this was just like something that people kind of hid in shame about. And so they just never talked about it, even though this is a really common condition. Like, it's really common. So whenever people with PCOS get together in areas, it's really amazing to see how validating it can be to know that, like, you're not the only one that's getting dismissed like this. And also it can be like infuriating. And, a lot of us who are socialized as women, like, we can be like, what the hell do we do with all this anger? And
yes.
And I'm like, it is rocket fuel for a food piece. It's rocket fuel to come together to help us change PCOS care. So like, let's do it. We need this anger in order to make the change that we need for people who haven't started this process yet.
Exactly. We need this anger. We need it. And we need to be able to use this anger productively to get our needs met, collectively, women as a whole. And I have found that anger has really helped me. It's helped me in the work that I do with my clients, as I'm sure it's helped you in the work that you do with your clients, but it's also helped me in my doctor's appointments. Whereas I think again, not to say that my experiences recently have been not traumatizing, but whereas I think I would have maybe come home and sort of like crawled into my little like shame shell, and I would have maybe like turned to my eating disorder because of what that doctor said to me. Instead, I went home and I got on the phone with 4 other doctors and refused to miss a meal because of what that doctor said to me.
Oh, that's important. You're so right. Because so many people have said that, like, if they were in recovery, for a lot of people, eating disorder recovery was something that they had been in for years and years. And then they were diagnosed with PCOS. And that was like a trigger to relapse and like immediate, because the doctor's like, well, guess you now have to cut out carbs. I know. I'm like, have you seen the thick medical record of like eating disorder treatment? And it doesn't matter, because that's where the anti-fat bias is like, well, it's worth the risk, I think. Because people are just like, well, we're not really sure what to do. So then it's something that is just thrown out there. But it's really unfortunate. And I think so a lot of people are activated then to start restricting, even if a part of their brain kind of quote knows better. But so much of that is because like the body responds, right? Like the body gets activated and is just trying to survive and survive the trauma,
Exactly. Now, in your opinion, because I know there's no exact research on this, or at least not to my knowledge, but what are some theories? Because I know that there are some. What are some theories about the link between perhaps trauma and PCOS? And not just in the sense that the process of getting diagnosed and the process of treating and managing because there's no cure, but the process of managing it can be traumatic. But are there theories and potential links about the cause of PCOS? I mean, I know we know it's passed down through families, but is there any relation to trauma and the onset of PCOS?
Yeah, that is something that is so interesting to me. And, we have like evidence-based practice and practice-based evidence. And this is where I rely a lot on the latter, the practice-based evidence. But, thinking about what has been researched already, it's been a while since I've gone on Google Scholar to really take a deep dive. But every like year or so, I'll go and be like, so anybody published anything on this? But, the thing that gets in the way with a lot of it is like for you and me, Alyssa, we're talking about diet culture as a trauma. And so much of PCOS research is like, hey, how is like, for example, and this is a stigmatizing word when I say it, so I just want to kind of give that kind of heads up, like sedentary lifestyle. How is that a predictor for PCOS? And so maybe they'll weave trauma in that way. And so I'm like, oh, what can I do with this research? Like, it's loaded with fat bias. So how can this be helpful?
Exactly.
You already have to do a lot of sifting. But what I notice, or what I know about PCOS and physiology, are 2 things that are to keep in mind. And if a researcher's out there that's like, I don't know, twiddling their thumbs and looking for some new research, hey, look into this. What we know,
please. Any researchers with idle hands, please.
Especially fat positive researchers. Exactly. I know they're out there. But we know people with PCOS, like I said earlier, most will have high circulating insulin levels. And what we know about systemic oppression and trauma-related systemic oppression is it causes higher insulin levels as well. And so that's really interesting to me. So, it could be the chicken or the egg thing, but and this is where, as a clinician versus a researcher, I'm like more invested in like where my clients are in the here and now. So, thinking about systemic oppression, like my clients who are experiencing racism right now, I know that's making their insulin levels higher now. So like,
exactly,
how can we help remove racism so they will have less insulin levels? Right. And then the other one is inflammation. And I should name too, inflammation and insulin are like diet culture magnets, right? Like diet culture loves those words.
Love it.
And I know it's out of the scope of the time of like what we have today, but that's all bullshit too, because that's only short-term research. But what we know with inflammation is in the long term, dieting, like chronic dieting, and the dieting can be like consistently dieting for 2 years, or it can be off and on dieting for 2 to 5 years, is something that has shown a causal link to more inflammation. And what that means is like basically dieting has been shown to cause more inflammation. And why that's important is because we know that inflammation predicts disease, or it has a link to more disease. Yeah. And that's why everyone talks about inflammation as this like, quote, horrible thing, when in fact, really, I mean, I'm getting into the weeds here, but inflammation is something.
I love it.
Inflammation is something that we need in order to like survive. Like if we get a cut on our finger and it's red and it's kind of warm, that's inflammation healing the spot. Yes. And people with PCOS, because of the hormonal imbalance, there's like this imbalance going on. So the body's having to do a lot more like cleanup work. And so there's just more of this inflammation, and it's just a sign that the body's having to work harder than somebody else.
Yeah.
So, so whatever we can do to help that person not have to work as hard is going to help. And what we know is systemic oppression, any of them, those are things that also are shown to cause inflammation. So, and that's where trauma can come into play as well, right? Like, we know trauma, you probably have more depth in that area, but like the things that I've read about trauma, how they interact with blood pressure, blood sugar, and insulin levels and inflammation, like it's similar. Yeah. And so I know less about like how PCOS occurs, or like how it like becomes like in a person's body, but it sure as hell makes it a lot worse to live with. And that's my practice-based evidence, And
I love that. I love what you said about like practice-based evidence versus evidence-based practice.
Oh yeah. I mean, well, in PCOS world, that's why I struggled for so long when I first started working with it. Is like, there's so little research on PCOS. Why? Well, it's because it's for people with ovaries. Yeah. So like, who's going to be spending research dollars on it? Well, now there's more, but it's all with like weight-centric kind of PCOS interventions. And so I'm like, well, how much of that research am I going to use besides showing, oh yeah, thanks for the 6-week-long keto research on 26 people. That really helps me.
Yeah. You're really changing the world with that.
Yeah. Thanks for spending all that money on that.
Right.
NIH.
God. We just have so much more work to do.
Yeah.
And it's a vicious cycle because, it's like what came first, the chicken or the egg? But we do know that there is a potential link, right? There can be a potential
I think
link.
There's something to it, especially like, I know as therapists, y'all talk a lot about like intergenerational trauma, and dietitians, we talk about epigenetics. And like, I think about like, how did slavery affect people experiencing PCOS?
Oh, absolutely.
Yeah. Just like, that's just one example. Like, how did different traumas that have been passed down through families, how does that affect people getting PCOS? I don't know the answers to these things, but like, I would imagine that it's a piece of the pie somehow. So
absolutely. We can't, I think it would be almost, sort of foolish for us to even deny that, even though we try to as a society, but it's like, all you need to do is take one read through Bessel van der Kolk's The Body Keeps the Score to know that trauma is stored in the body. And when there's no release, it tends to just get passed down and passed down and passed down.
Right. Yeah, for sure. So much. Yes.
So much. But I feel okay. So I feel like I've learned so much. I love conversations with Julie. They're the best.
Thanks, Alyssa. You always make me feel so good about myself.
I mean, well, it's just, it's so hard to find people who understand this, but also have a passion for it. Mm-hmm. And I love it. I love all of it. I love your passion for it. I love the work that you're doing. I love that you are, fighting for people to have a voice. And all of that is so important. And so I've mentioned your podcast. So if the listeners out there would like to find you, which I'm telling you all, you need to go check out Julie's podcast. I said it in your introduction, the Love Food podcast. It's so good. It is such a wonderful and unique twist on podcasting. It's great. It's great, people. It's great. So, okay. You tell us, what are all the different ways people can find you, work with you, hear from you? I know you have lots of different kind of irons in the fire, so to speak.
Well, yeah. And I have less irons in the fire, I think, now than I used to. I'm like taking some of those irons out. So I'm like, yeah, I'm tired.
That's not a bad thing.
Yeah, no, I think it's been good. But the best place for you, the listener, to find me is if you go to my website, juliedillonrd.com. I have a page. If you go to juliedillonrd.com/freebies, if you have PCOS, I have a PCOS roadmap. That's a really great place to start. And it's like the top 3 things that I tell people if they're like, hey, where should I start? If I'm like thinking about moving away from diets with PCOS, that's a great place to start. And also to see like, hey, do I like how Julie talks about PCOS? It's a great way to kind of get to know me. But what you also will find on there are links to like other kind of free downloads I have, and you'll find my podcast. I have a PCOS course. I'm going to be actually launching a new program in the spring. So be on the lookout for that. It should be super fun. I'm excited to get that out to the world. And yeah, I'm on Instagram, and I'm actually like turning down the dial on how much I'm on there. But if you are someone who loves being on Instagram, go to Food Peace Dietitian. But mostly, if you like want to connect by going and getting onto that freebie page, you'll automatically get entered into my email list, and I will be emailing you every once in a while, and we can chat that way.
That is awesome. And I am actually on the page right now. And also Julie's website is just so beautiful.
Oh, thank you.
The colors are so peaceful. Like your website it's just beautiful. Nice. So to the listeners out there, I will link Julie's website right to the freebies. And, as she said, there you can find everything, the podcast, all the freebies that she has. And then I will also put her Instagram handle in the show notes for today. Julie, thank you. I have been looking forward to this for quite some time, and I'm so grateful that you really just like came into my life in the wild and unconventional way that you did.
Yes. And I'm so glad that you introduced yourself to me. Like, I feel like this is like a new friendship. So thank you so much for connecting with me. And I look forward to chatting again in the future.
Yes. Thank you. Thanks for listening, everyone. For more information, please head over to lightaftertrauma.com, or you can also follow us on social media. On Instagram, we are at lightaftertrauma, and on Twitter, it is at lightafterpod. Lastly, please head over to patreon.com/lightaftertrauma to support our show. We are asking for $5 a month, which is the equivalent to a cup of coffee at Starbucks. So please head on over again. That's patreon.com/lightaftertrauma. Thank you, and we appreciate your support. Someday more.